Hi, I'm Dr. Nixon with Healing Peak Regenerative Medicine, and today I want to talk to you about how food allergies and food sensitivities can be causing pain in your body and maybe even making arthritic conditions worse. And I think this goes widely undertreated and underdiagnosed. A lot of patients are not educated about this, and a lot of times I have patients ask me, hey, why didn't my doctor tell me about this? Why didn't my primary care physician tell me about this? And the reason for that is it's not in their wheelhouse. They don't have any curriculum on food allergies and food sensitivities in their schooling. And so unless that specific physician goes to seek it out, they're not going to have ever learned it. So how could they educate you about something that they've never been educated on? And right now I'm seeing a lot of testing come to people who, you can order fertility testing on your own now, and you can order food allergy, food sensitivity testing on your own from these different labs, functional labs that are popping up and marketing to directly to people, which is great. I think people should be advocating for their health and be interested in finding out things that maybe they wouldn't have found out before, but you also really need to know what you're paying for, what you're getting, and how to interpret those results correctly so that you can use them. Otherwise, there really isn't any reason to run the test. And so that's something that, we're taught in medical school is you should be only ever running tests to confirm a suspicion that you have based on other criteria that is happening, based on history of present illness, which is part of the questions we ask when you first come in about your chief complaint or the reason why you're coming in. And so what I wanted to really discuss is, I only used one food allergy, food sensitivity lab. I've been using them the entire time I've been in practice. I get amazing clinical results. I trust their process. I understand how they do their lab tests. And I have not seen these kinds of results with other food allergy and food sensitivity testing labs. And so I encourage people to be very, very careful when choosing which lab or which doctor and lab to use for food allergy, food sensitivity testing, because I've seen a lot of them be really inaccurate and cause more confusion than clarity, which is not the way you want to go. So once we get a legitimate food allergy, food sensitivity test, it is a tool. It allows us to see in the dark of your body, what is your body creating antibodies to, which foods are having an antibody reaction in your body that could be causing this overall inflammation, this inflammatory response, causing many, many different types of symptoms. And today we're primarily going to be focused on pain. But those food allergies and food sensitivities can cause inflammation, which then causes joint pain. They can also cause migraines, irritable bowel syndrome. Many different types of symptoms can be caused by food allergy and food sensitivity. There are some other blood markers that we can look at before we ever even go towards food allergy and food sensitivity testing. Inflammatory markers, ferritin, typically a stored iron marker, but when elevated way beyond normal levels, it becomes an inflammatory marker, an indication of inflammation around the whole body. C-reactive protein is another one, and sedimentation rate is another. There are some other markers in the lipid panel, which is cholesterol, and the CBC, which is the complete blood count panel, which shows you red blood cells, white blood cells, differentials between white blood cells that can show us if there's some inflammation in the digestive tract as well. So before we even get to food allergy and food sensitivity testing, we can kind of see that there may be some there already. So what happens? Well, people order these tests and then they eliminate the foods, but they don't always eliminate them correctly. And that poses a problem because if it's not done very systematically and very specifically with an understanding of the process of why you're eliminating and how to reintroduce those foods correctly, then you may get mixed results. And then you may assume that it was unsuccessful. And so it's really important to, one, understand what test you're ordering from where, and if it's a legitimate, valid test, which is hard to do unless you really do your research and really know what you're doing. And then secondarily, the elimination process is just as important as the lab process. So once you get the elimination diet back, it kind of lets you see in the dark which foods do you need to eliminate. That is the true test. That is the true positive result. So you will eliminate foods for 4 weeks. Gluten and wheat takes 6 weeks. It takes 21 days for your digestive system to reset It's immunological response to a food. So you have to be extremely strict and understand that some things are hidden in places, so you have to read all the ingredients in order to really have it be accurate. And so you really need to avoid those foods strictly for 4 weeks and then reintroduce them correctly. The positive result comes when you have eliminated those foods for 4 weeks, or wheat and gluten for 6, very strictly again, and if the symptoms that you were having have gone away entirely. And then comes the process of bringing those foods back in one at a time correctly. And if you'd like to know more about that process, I would love to have a chat with you. We treat pain related to food allergies and food sensitivities all the time. It's something that I really like to rule out ahead of time before I do any type of prolotherapy and PRP injections, because I want that person to get better. And many times, their pain decreases by 50% or more just by eliminating food allergies and food sensitivities, because that food allergy and food sensitivity, when you eat something inflammatory, is causing a systemic reaction all over the body. It's inflaming you, right? It's inflammatory, as if you sprained something or you injured something. It's kind of like micro-injuring you every time that you're eating that food that's having a reaction with your body. The other thing that people ask me a lot about food allergies and food sensitivities is if they'll have to avoid them for the rest of their life. You do not have to avoid them for the rest of your life. There is a conversation around that that's really important about community and food and celebrations and how to mitigate reactions to those foods. And sometimes food allergies and food sensitivities go away. Primarily food sensitivities. Allergies are a little more stubborn, but food sensitivities will change and shift throughout your life, and they can go away if you are doing the appropriate things to heal up the inflammatory response that's happened in the digestive tract. But most importantly, people are very typically happy to avoid something if it's causing excruciating pain and migraines. And there are ways around it. And that's something that takes time, and it's a journey to find substitutes for things that you used to love, but they're out there and they exist. It's just a matter of having someone help you along that path. But I just wanted to do a plug about food allergy and food sensitivity testing and how it is related to pain and how that whole process works, because I think the water gets really murky when you're out there trying to eliminate gluten and wheat on your own and you think you can do it for a few days, or you can kind of do it here and there, or you weren't really super strict about it because you got some hidden in there somewhere, and then that really muddies the results. It's, if you're gonna go through the process of eliminating foods, don't you want to do it correctly the first time? Because it's not easy, and it's pretty uncomfortable most of the time because you have to revamp your grocery list and your diet and everything. So I really encourage you, if you're not sure exactly what you're doing, to get a naturopathic doctor to help coach you and to make sure that you're ordering the most valid, high quality tests. That's it for today. Thanks, guys. Have a great week.